Hi, my name is Grace Briantis. I'm a family nurse practitioner student at SVSU. I'm here to do the head to toe assessment. First, we're going to start with the eye. So if you can remove your glasses for me, please. I would be inspecting the corneas, the irises, the lenses, the color, the sclera, checking the symmetry of the eyes, which there's no abnormalities. I would be looking at the conjunctival sacs, which are nice and pink, no excessive tearing. I would then check cranial nerve 2, which is dilation of the pupils. So I would go ahead and dilate the pupils, which constrict to a 2, so they go from a 3 to a 2. That was cranial nerve 2 intact. Then I would go ahead and do the consensual test. So I'm going to have you, I would shine my light in one eye and look at the opposite eye for constriction. So consensual test is normal. And then I would test cranial nerve 3, 4, and 6. And that would be ocular motor, trochlear, and abducens. So I will go ahead and have you follow my pen with only your eyes. Okay. So those cranial nerves are intact. There were no abnormal ocular motor movements there. And then I would test for convergence and accommodation. So go ahead and look at my pen light. Okay, and look at my pen light and then into the distance. Okay, no abnormal movements there. So then I would go ahead and turn the lights off and look at the red reflex of the eye, as well as the optic disc and the vessels. The optic disc was observed, as well as the red reflex. There was no signs of any bleeding or clotting. So then we would go ahead and move on to the head. So with the head, I would go ahead and palpate and look for any lumps, bumps, bruising. I would note that the hair is thick and evenly distributed. It's coarse in texture. It is dry. There is no dandruff or scaling or infestations. I also would look at facial symmetry, which is symmetric. And then I would do cranial nerve 5, which is the trigeminal. And so with that eye, you're going to tell me when you feel me touch. Okay, and then I'm also going to test the motor for the cranial nerve 5, if you can clench your teeth for me. Okay, we are going to test cranial nerve 7. If you can smile, frown, puff your cheeks out, close your eyes real tight, and lift your eyebrows. Okay, cranial nerve 7 is intact. I will then go ahead and move on. No, I have to palpate and percuss the frontal and maxillary sinuses. Any pain? Okay. Any pain? Okay. Now we will go ahead and move on to the nose. So we will be looking at the nose for any polyps, abnormal lesions, bleeding. Go ahead up for me. Okay, there is no deviation of the septum. Turbinates are observed. No bleeding. Nasal mucosa was nice and pink. I will now check for nasal patency. So go ahead and breathe out. And breathe out. Okay. We are going to check cranial nerve 1, which is olfactory. So go ahead and close your eyes. Smell. What do you smell? Cinnamon. Okay. And one more. Okay. So cranial nerve 1 is intact. Then we would go ahead and move on to the ears. So with the ears, I again would be looking for symmetry, any abnormal lesions. There's nothing seen on the outside. I would test for otitis externa by pressing on the tragus, pulling up on the auricles, back and slightly out. Any pain? No. Okay. We would test for otitis media by pressing on the mastoid bone. Any pain? No. Okay. Then I would go ahead and take a look in the ears. Okay, so I would note that there is very little cerumen in the ears. The tympanic membrane is visible and intact. The cone of light in the right ear is at the 5 o'clock position. I also would look at the left ear, and the cone of light position of the left ear is going to be at the 7 o'clock. Then I would move on to the mouth. Oh, the whisper test for cranial nerve 8.
ABC. 1, 2, 3.
Okay. So cranial nerve 8, which is acoustic, is intact. Then we will move on to the mouth, where I would be observing and inspecting the lips, gums, and oral mucosa. So if you can open your mouth and say ah. Okay. So cranial nerve 10, which is the vagus, is intact. The uvula was midline, and it moved simultaneously with the soft palate. Glossopharyngeal, which is cranial nerve 9, is the gag reflex test, which we only verbalize, and then I will have you stick your tongue out and in and side to side. So cranial nerve 12, hypoglossal, is intact as well. When I looked into the mouth, the oral mucosa was nice and pink. There were no lesions, no bleeding, no white patches, anything like that. Everything looked okay there. Then we would move on to the neck, where with the neck, I am going to look at the patient and have him do cranial nerve 11 test. So with that, cranial nerve 11 is the spinal accessory, so go ahead and push up and turn your, and the other way. Okay. Cranial nerve 11 is intact. Then I would go ahead and palpate the trachea, which is midline. I would slightly displace on each side, and that is intact. I would then come from behind and palpate the thyroid and have the patient swallow. Okay, no bulging noted. The landmarks of the thyroid are the thyroid cartilage, the thyroid gland, the cricoid cartilage, the trachea, and the C-rings of the trachea as well. I would then go ahead and palpate the lymph nodes. You can sit up for me. So we would do the preauricular, the postauricular, the temporal, or the occipital, the tonsillar, the submandibulars, the submental, and then we would do the posterior and anterior cervical chains, and then have the patient turn to each side and palpate the deep cervical chains. No lumps or nodules there. Any pain?
No.
Okay. We will do the supraclavicular node. Go ahead and lift up for me. Any pain?
No.
Okay. No nodules felt there. So the neck is complete. We will go ahead and move to the chest and the lungs. So you can go ahead and take your shirt off. So the first thing I would note would be to look at the presentation of the patient. There is no excessive breathing, no accessory muscles being used. There's no sign of cyanosis. I would go ahead and now I would look for the AP lateral ratio. So if you can sit up for me, I would do. So the AP lateral ratio is 2 to 1. I would then go ahead and auscultate the front. Deep breath. Deep breath. Okay. So then you can go ahead and sit up. And then we are going to test for, we'll look at the symmetry of the chest, front and back. And then go ahead and say 99.
99.
Okay. Tactile firmitis test. So the vibrations were felt evenly and at the same intensity on both sides. So now we will go ahead and test for chest expansion. Go ahead and take a deep breath. Yep. So thumbs separated about 2 centimeters, which is normal. We will then go ahead and test for CVA. So I would put my hand at about the 10th rib and hit with my palm, with my fist. Any pain there?
No.
Okay. So then we're going to go ahead and percuss in the ladder technique. Okay, and there was resonant sounding there. I would go ahead and auscultate now. Deep breath. Okay, now we will go ahead and test for egophony. So when you feel my stethoscope touch your back, go ahead and say E-E-E. Okay, the long E sound was heard, meaning there is no underlying consolidation. So that's okay. And then I would count the breath sounds, count the respiration. So go ahead and just breathe normally for me. Okay, so there was 4 in the 15 seconds, so times that by 4, that would be 16 respirations per minute. Now we're going to go ahead and move on to the cardiovascular. So with cardiovascular, I would first check the carotids, and then I would listen for bruits, which I should have done on the neck portion with my bell. Hold your breath. Okay. Then we will test the brachial pulses and the radials. Posterior tibials and the dorsalis pedis. All of those are 2+. I would then go ahead and have the patient lie back. And we are looking for any abnormal pulsations or thrills that would be observed just from looking at the patient, which I don't see. I would feel for thrills, lifts and heaves with the pads of my fingers. And then I would feel for thrills with the balls of my hand. Okay. Then I would go ahead and auscultate with the diaphragm and the bell. So with the diaphragm, we're going to go aortic, pulmonic, Erb's point, tricuspid, and the mitral. And then with the bell, we're gonna do Erb's point, tricuspid, and the mitral. So with the diaphragm, S1 and S2 were heard. They are heard the loudest at the mitral point. And then with the bell, there were no murmurs, S3s or S4s heard. So now I'm gonna go ahead and count the apical the apical pulse. So apical pulse would be about 78 beats per minute. I would also palpate for the PMI, which is at the midclavicular, fifth intercostal space. And then I would go ahead and move on to the abdomen. So with the abdomen, we're making sure that the there is no distension, no edema, no signs of abnormal movements or pulsations, which I don't see. I would start with auscultation with the bell in all 4 quadrants. Active bowel sounds in all 4 quadrants. I will listen with my bell for the descending aorta, the renal arteries, the iliacs, and the femorals. And no abnormalities heard there. I would then be able to listen for percuss the epigastric bubble. So I would start at the midclavicular line at the 5th intercostal space and percuss until I heard tympany. And then I would percuss for the liver border. So I would start in the right lower quadrant and percuss upward until I heard dullness. And then I would start from below the chest and go downward until I heard dullness and measure the space in between, which for a male should be about 8.5 centimeters. Then I would verify that with the scratch test. So with the scratch test, I'm going to use the diaphragm of my stethoscope, place it under the xiphoid process, place my finger in the right lower quad and scratch upward until I hear a sudden increase in volume. That would be the lower border of the liver, and then I would continue upward until I heard a sudden decrease in volume, which would be the upper border of the liver, and that would be the scratch test. So then I would have the patient come to the right side so I can percuss the spleen. Okay, so that was good there. Go ahead and lay back on your side. Now we're going to go ahead and, so we've auscultated and percussed. We can go ahead and palpate. So we'll do a soft palpation in all 4 quadrants. Any pain?
No.
Okay. Now we'll go ahead and do a deeper palpation. Any pain?
No.
Okay. So there were no bumps or lumps out there. So then we would go ahead and do our special test, which with McBurney's, we would go ahead and do a deep palpation. Go ahead and take a deep breath for me. Okay, so with the deep palpation there, I did not feel the liver, so we are negative for cholecystitis. Then we would do McBurney's, where I would palpate on the right and the left side. Is there any pain?
No.
Okay, negative for appendicitis. Then I would do Brzezinski's and go ahead and lift your head up. Okay, there was no flexion of the lower extremities, so that is negative for meningeal irritation. And then I will have you lift your leg up Any pain? Okay, so negative Kernig sign for meningeal infection or meningeal irritation. So then we would go ahead and move on to the musculoskeletal. So you can go ahead and stand up. And you can put your shirt back on if you'd like. So go ahead, we would be looking for the symmetry of the muscles and the extremities, upper and lower. So then I would have you go ahead and we would assess your gait. So go ahead and just walk for me with your arm swinging at its sides. Okay, and then come back to me heel to toe. Okay, then turn around and walk on your heels. And then come back to me and walk on your toes. Okay, so then you can come here. We will attest for Romberg. So go ahead and close your eyes. We would do this for 20 seconds, making sure the patient isn't swaying. Okay, you can open your eyes. Now we're going to go ahead and test the active range of motion. So with the head, we're going to test flexion and extension. Go ahead and put your chin to your chest and your head back. And then we're going to test abduction and adduction. Turn right to left. Faster, it's on a time. And then now we're going to test external and internal rotation. Go ahead and ear to ear. Okay, so then we're going to go ahead and test the shoulders. So you are going to put your arm out and up above you. Flexion, go ahead and put your hands behind you. Extension, we're going to do abduction and adduction. Go ahead and put up to the side and upward and cross your arm. And then we're going to do internal rotation and external. Go ahead and scratch your back. And then go ahead and lift your arm up across your chest. Okay. Then we're going to test the spine. So we're going to have you twist side to side. And then we are going to have you bend over and lean backwards. Okay, and then go side to side. Alright, so then we would test for scoliosis, looking at the spine of the back. Go ahead and bend over. It looks midline there. So that's that. Now we can go ahead and have you lay back down. And we are going to test the hip flexations first. So we're going to do flexion and extension. So knee to the chest and then back. And then we are going to do internal and external rotation. And then we are going to do abduction and adduction. Okay. Then we will go ahead and do the knees. So with the knees, we're going to go ahead and do flexion and extension. Then we're going to do the ankles. We're going to have you go up and down, which is dorsiflexion and plantar flexion. Then we are going to have you test the ligaments. So we start with the MCL, then the PCL, MCL, LCL, PCL, and ACL. So with the MCL, I am going to grab the lower portion of the leg and just wiggle it side to side. Any pain? Okay. Then I am going for the LCL, we're going to grab the ankle portion and move side to side. Any pain?
No.
Okay. Then the PCL, we're going to apply pressure and move side to side. Any pain?
No.
Okay. And then with the ACL, we're going to hold the back of the thigh, and move the knee. Any pain?
No.
Okay. So then we will go ahead and grade the strengths. So we can start with hip first. So go ahead and push inward, outward, down, and up. Okay. Then we would test. You can go ahead and push down and up. All right. So those were 5 out of 5. Then we can have you sit up. And then we would test the bicep, tricep, deltoid. So go ahead and put your arms like this. And then don't let me push back. Okay. Side to side. Okay. Then we would go ahead and test the knees. So go ahead and push back and up. All right. Then we would test the reflexes. So with the reflexes, we are going to start with the biceps, which is at the C5 and 6. So I'm going to just go ahead and relax your arm. Place my thumb with the AC and palpate my thumb. Feel that reflex there. Then we do the tricep, which is at C6 and 7. Let your arm relax. Then I'm going to go ahead and put the tendon. Saw the reflex there. Then we do the brachioradialis. Okay. Then we would do the patellar. Normally I would let his knees or his legs be dangling, but that can't happen right now. So we would look for the patellar reflexes. Then we would also do the ankle jerk and hit the Achilles tendon. And then we would do Babinski, where we would rub the bottom of his foot and make sure that there was no fanning of the toes. And our reflexes were 2+. And that is the end of our assessment. Thank you so much.